My name is Jen Kuretski, and I have the privilege today of presenting this poster on behalf of the team at Midway Specialty Care Center in Florida in the United States. Our poster is entitled, Weight Change in Females with HIV Switch from 3-Drug Combination Antiretroviral Therapy Regimen to or newly initiated on a 2-drug antiretroviral therapy regimen, a real-world study. We know historically the 3-drug regimen has served as a foundation of treatment for HIV for the last 2 decades. We also know more recently in the last decade that the treatment of HIV has consisted historically of 2 NRTIs plus an integrase inhibitor most commonly. Based on more recent data, however, the 2-drug regimen has shown similar efficacy in virologic suppression compared to the standard of care 3-drug regimen. In addition to the clinical outcome of virologic suppression, comorbidity such as weight gain has also been identified as a concern in people with HIV taking antiretroviral therapy. Therefore, we also explored this in this study. The objectives of this study were to compare and contrast virologic suppression rates in females with HIV on 2 versus 3-drug regimens at 12 and 24 weeks post-initiation of therapy, and to also describe the change in weight greater than 5 or 10% from baseline at 24 weeks in females with HIV on 2 versus 3-drug regimens. When we looked at the sample population, we looked at all adult females with HIV-1 who were seen at one of the 7 HIV clinics in Florida between January 1, 2019 through March 31st, 2021. We did take a look at our control group consisting of females with HIV who were initiated on a 3-drug regimen during that similar time for comparison purposes. Only patients with complete baseline data and 24-week data were available for analysis at this time, and that's what you see included here. Under sample population, you can see there are some similarities in demographics between the 2 versus 3-drug regimen groups. The median age in the 2-drug group was around 53 versus 43 in the 3-drug regimen. A majority of females with HIV in both groups identified their race as Black, ethnicity as non-Hispanic, and the type of switch was a switch, or the type of start was a switch, not a first-line regimen. When we look at 24-week data, you can see that 100% of the females with HIV on the 2-drug regimen had virologic suppression at less than 200 copies, compared to 93% virologic suppression in the standard of care 3-drug regimen. We also, as I mentioned, looked at weight. And we noticed that about 40% or 6 of the females with HIV on the 2-drug regimen experienced a 5% or greater increase in weight over 24 weeks versus 35% of those on the 3-drug regimen. A little bit more detail on that, when we did look at greater than or equal to 10% increase in weight over 24 weeks, we noticed similar rates at about 21% in either of the 2 versus 3-drug regimens. In conclusion, clinical outcomes such as virologic suppression and changes in weight appear to be similar between females with HIV on 2 versus 3-drug regimens in this sample population. Although the sample population is small, it is clear here that the 2-drug regimen should be considered when initiating antiretroviral therapy or switching antiretroviral therapy in females with HIV. If you have any questions, please do not hesitate to reach out to us. Thank you.